All prenatal diagnostics are voluntary. During your pregnancy, it is you who decides whether or not you wish to receive information about prenatal testing. It is you who chooses whether or not you want to have prenatal testing done. If you wish to have prenatal testing done, your healthcare provider will inform you about the options that are available to you. Today, there are many different prenatal diagnostic tests available that can provide information about certain chromosomal conditions or congenital disorders, but no test can detect or rule out all genetic conditions and congenital disorders. It is important that you receive information that can contribute to an informed decision about prenatal testing, a decision that matches your own values and needs. Your healthcare provider will inform you about which tests and which method of analysis is most relevant to your particular situation, but it is always your decision whether or not to have prenatal testing. One of the most important questions to consider when deciding about prenatal testing is, what will receiving this information mean for you? Knowing the answer to this question can help you make decisions that feel right for you. There are two different types of tests. One type is diagnostic tests such as amniocentesis or placental sampling. They can give a definite yes or no answer. That is to say, they can confirm a certain diagnosis. However, these tests involve a small increased risk of miscarriage. The second type is probability assessment tests, such as NIPT and the KUB test. In general, these tests do not pose a risk to the fetus or mother. Probability assessments for chromosomal conditions do not provide yes or no answer, but they will give you information about whether the probability is higher or lower for chromosomal conditions. Prenatal genetic testing is always voluntary. Some women want a yes or no answer and wish to do a diagnostic test right away, such as amniocentesis or placental sampling. Depending on where you live in Sweden, this may be an option. Others choose to make a decision about diagnostic testing first after receiving a high probability assessment from the NIPT or KUB test. Questions to consider about diagnostic tests. If your baby has a genetic condition, would you want to know about it prior to birth? What would receiving this information mean for you? Do you feel that a yes or no answer would reduce your worry? How do you feel about the risk of miscarriage in connection with these tests? Questions to consider about tests for probability assessment. How would you feel if the test result shows a higher probability of a chromosomal condition? Would you consider a diagnostic test if the test result shows an increased likelihood of a chromosomal condition? If not, how would you feel about waiting until the baby is born to know for sure if there is a chromosomal condition? Would this information help you feel more prepared? How do you feel about receiving information that cannot give you a definitive yes or no answer? Some women feel that prenatal genetic testing is not right for them. Consider the following questions. Would you prefer not having to make a decision about a diagnostic test if NIPT or KUB tests show a higher likelihood of having a chromosomal condition? Are you confident about how you feel about your pregnancy, even if the baby has a chromosomal condition or congenital disorder? There are several test options within the field of prenatal testing. Based on a number of factors, your healthcare provider will inform you about which options may be relevant for you. But the decision whether or not to have prenatal testing is always your own decision, and it should be in accordance with your values, personality, beliefs, and needs. Your decision may be different than one of your friends or neighbors would choose, and that's okay. Being well informed is the best way to reach a decision that feels right for you.